This is me Gayatri Agal and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So here I would like to discuss with you all about 13th of May 2023 OET exam. So in which I'm going to discuss with you all about OET writing. There were two letters asked in different countries. So one is the known case letter, another one is the unknown case letter. So let's move on to the case note. So first one I'm going to deal with you about unknown case letter. Okay, so the patient name was Lucy Foster. She is 81 years old. Actually, she got admitted in the hospital due to a fall and she broken her clavicle bone. And she got treatment and she got discharged from the hospital the very next day. Since then, she has been under community nurse home visit. So here, a community nurse writing a letter to aged care home manager for the full-time nursing care, as per the patient's request as well as the doctor's request. Okay, and here the patient is living on her own and she has a daughter and she is unable to look after her mother full-time due to her work pressure. Apart from that, she has Parkinson's disease and she is on treatment for that old history of fracture, and also she has difficulty in mobility and she is using the crutches and she is on physiotherapy for the same. And also she has a high risk of fall at home. On 11th of December 2022, she got admitted in the local hospital due to a fall at home with a clavicle fracture. Thereby, she has undergone for an X-ray and the X-ray revealed the clavicle fracture and she received adequate treatment and management along with the wound dressing. And the 12th of December 2022, she got discharged with the community nurse home visit. So, since then, the community nurse has been doing her home visit for the patient to change the dressing twice in a week. However, the doctor is not satisfactory because she is unable to look after her mother completely due to her work pressure. So, the doctor suggested to the community nurse for the short-term home care management. However, the patient is denied that, and also she accepted for the permanent move to the aged care home. So here, the patient is requesting a community nurse to write a letter to an aged care home manager to ask the placement. So the patient will be transferred to the aged care home on 11th of she's going on the 11th of January 2023. So here we have few discharge advices, like follow-up advices for the aged care home persons who is going to look after Miss Lucy Foster. So one is that they have to monitor her medications and also proper wound dressing, continue her physiotherapy, and also encourage her to walk with the help of crutches, and also continue her medications, especially the lactulose laxatives for her constipation, and also she is taking carbidopa for her Parkinson's disease. And also she has an appointment on 17th of January 2023 in fracture clinic to review her fracture condition. So this is about the letter. So now, how to write a case note. So first, as usual, we are writing the date, today's date, what they have in the letter, that is the date we are writing on the top of the paper. So the page, they have given the date as 7th of January 2023. So that we are going to write it on the top of the paper. Next one, we are writing the addressing person. To whom we are addressing? We are addressing to the aged care home manager. And then salutation, writing the patient name in the reference as well as the patient age. So patient name is Mrs. Lucy Foster and her age is 81 years old. Okay, now coming to the introduction. To make an introduction, definitely we need three things. One is patient name, and second one is purpose, third one is patient condition. So patient name is Mrs. Lucy Foster, condition clavicle fracture, recovering from clavicle fracture, and the purpose is full-time nursing care. So now we are going to make an introduction. So Miss Lucy Foster, who is recovering from clavicle fracture, full stop, right clavicle fracture, full stop, she requires your full-time nursing care. That's it. So as they have written as a transfer letter, so we can just Miss Lucy Foster, who is being transferred to your facility for full-time nursing care, full stop. She is recovering from right clavicle fracture. This is the way also you can read. So who is being transferred to your facility on 11th of January 2023 for full-time nursing care, full stop. She is recovering from right clavicle fracture. So this is another way of writing an introduction. Okay, now coming to the present medical history paragraph. So here few students might have the confusion, either should I write the admission information first, nor I should write the home visit information. So here I will say better to start with the admission, because admission has the continuity of the information. So why the patient got admitted, how the community nurse ended up in the home visit service. So this is a continuity, so better to start from that. So Mrs. Foster was admitted on 11th of December 2022 with a clavicle fracture following a fall at home, full stop. Therefore she has undergone an x-ray and it confirmed the fracture, and also the affected part was supported with a sling and the wound dressing has done on the affected area. She got discharged on 12th of December 2023 with a community nurse home visit support. Since then, she has been under community nurse home visit for wound dressing twice in a week. However, her daughter is not satisfactory as she is not able to take care of her mother completely. Full stop. Therefore, she decided to offer a short-term nursing care for her mother. But the mother is denied it and she accepted for the permanent nursing care. During today's visit, the patient, Mrs. Foster, recommended to a community nurse write a letter to a aged care home manager for permanent placement for the full-term nursing care. And she will be transferred to the home care aged care home on 11th of January 2023. So this will be your present medical history paragraph. Now coming to the social background. So Mrs. Foster is a widow and lives alone with her daughter as she is unable to look after her mother due to work pressure. She has Parkinson's disease and is on carbidopa for that. She is taking laxatives for her constipation. She has an old history of fracture and mood swings problems, such as she has sometimes anxiety, stress and cognitive behavior problems. Thereby, she is on cognitive behavioral management therapy. So this all information we have to write it in the social background. And then we are moving to the recommendation paragraph. So what they have to do once she move with them. So first thing is kindly monitor her medication compliance, especially her laxatives, carbidopa for Parkinson's disease, all those things. And then it would be appreciated if you could do her wound dressing regularly and make sure that she is continuing her physiotherapy and walking with the crutches. And next thing is you can tell them, most importantly, assist her for transfer from bed to chair and chair to bed. And then you are saying, please make sure she has an she has an appointment in fracture clinic on 17th of January 2023. So this is the recommendation paragraph. And then we are just writing, thank you, please contact me for further details, and yours sincerely. If the name has given, addressing person name has given, you have to complete the letter with yours sincerely. If they not given, you can complete the letter with the yours faithfully. So this is a Lucy Foster letter, so which is the unknown case letter, and it is a transfer letter, transferring to the aged care home. Okay, so the other letter which has asked was a known case letter. So here the known case letter, what is the patient name, which means the patient name is Lucio and he is a 68-year-old person, and the person was admitted into the hospital for the surgery because he has been suffering with the severe leg problem, like vein problem. The patient was admitted in the hospital for the leg vein surgery, and the patient was suffering with the severe leg vein venous problem. And we are writing this letter to the district nurse who has been looking after the patient until the discharge. So she was the nurse looking after the patient. So we are after the surgery, and we are writing this letter to the same district nurse to continue the discharge advices. So she knows that how long the patient has been suffering with the problem and what is the reason for the patient to admitted in the hospital because of peripheral venous disease. And the patient was admitted because of the peripheral venous disease to correct that problem with the help of a surgery. So Liu Shou, he is 68 years old patient writing a letter to a district nurse who is already looking after the patient until the patient get admitted. So patient got admitted in the hospital, local hospital, for the correction of his peripheral venous disease. And after the surgery, the patient is being discharged under the district nurse care, and who is already known case of the district nurse. So what the nurse has to do for the patient? So here the nurse has to do for the patient is, the patient has to be assisted for activities of daily living, and also the nurse makes sure that patient is wearing the stockings to enhance the blood circulation, and also patient is living on his own, so the patient needs meals on wheels delivery system, and also compliance with the medications. So all those things has to be written to the district nurse. And main thing is, it is not mandatory to write the patient's social background and past medical history paragraph, because the patient is already under the district nurse care until getting admission to the hospital. So this is the unknown case letter. Sorry, it is a known case letter we are writing. So these are the two letters have been asked in their exam. So these explanations will help you for the students, will help you for all for preparing for your upcoming exams. So there were two letters, one is known case letter and unknown case letter, and the unknown case letter was a transfer letter, and the known case letter writing a letter to a district nurse who was looking after the patient before discharge, before admitted into the hospital. Okay, so I hope this all information will help you for you to prepare your upcoming exams. Whomever wants to join in our online classes, we have 40 days, 50 days, 60 days, and also 10 days. And separately we are taking classes for writing and listening, reading, speaking, and also we have a packages, and also we are giving classes for the beginners, and mock batch also is running on. So whomever wants to join in our class, our number has given in our description. You can contact us at any time. So until then, bye bye.